New York is reporting just over 7,000 new COVID cases in the state. Another 7,000 people are being treated for the virus in hospitals statewide. 1,100 people are in intensive care units. Today, Governor Kathy Hochul announcing COVID-19 cases statewide dropped nearly 50% since the week prior. Case rates have fallen in all regions of New York. COVID hospitalizations are dipping too. But when asked if the statewide masking mandate would be extended, the governor said, although the situation is improving, there is still concern.
We knew that this was going to expire February 10th in anticipation that the winter surge would be heading down, and it is. We're in a much better place. But we have to decide what that looks like. We're not prepared to throw in the towel and say we're done fighting COVID. We are so far from that.
Hochul also said that new hospital admissions were down nearly 33% week over week. Still, local hospital systems are expecting a new shipment of help as soon as next week. It's all part of the governor's plan to alleviate staffing shortages amid the pandemic. Erica Cost joins us live to break down these details of what it will look like. Erica?
Good afternoon, John. Well, we saw the first deployment of National Guard members about a month ago, and now the governor is reaching out for more help. She's working with federal officials to do this, and this time around, they're focusing on hospitals. Clinical leaders at URMC say they're receiving 20 medically trained military doctors, nurses, and respiratory therapists in the coming days. They'll be assisting in what they call a major staffing vacancy across the system. One area of focus for their stay, over 200 patients are admitted right now at Strong Memorial for COVID-19. URMC leaders say they're grateful to see this kind of help, not just in the hospital, but it's going to be across the state and in nursing homes. For months, they say they've been unable to free up beds because nursing homes are unequipped to take on new residents.
Nursing homes are still struggling and cannot take the number of patients that they typically take. And we have 80. Typically, we have 20 patients that await nursing homes. We always have a few. Takes, sometimes several weeks to get them placed. But we have a number of patients that typically would be in nursing homes that are still occupying our hospital beds.
Now, those National Guard members are still deployed locally in Monroe County Hospital. And coming up at 5, we'll go more in depth on COVID-19 and those hospitalizations across our region. In Rochester, Erica Cost, News 8.
All right, Erica, thank you. The governor also saying today she's working to increase the healthcare workforce by 20% over the next 5 years.